This recorded lecture will be going over the review for Med-Surg 1, Exam 6 Study Guide. And we'll start with Chapter 31, the musculoskeletal system in the Med-Surg textbook. What is the best method for prevention of osteoporosis? So we can find this on page 745. Weight-bearing exercise throughout life is needed to maintain bone mass and can decrease the incidence of osteoporosis and increase muscle strength, mass, agility, balance, and coordination, therefore preventing falls and consequent fractures. Define goniometry. We can see this on page 746. You can also see a picture with it on page 746 in figure 31.3. The measurement of range of motion in a joint is called goniometry. What exercise is useful in preventing contractures? So we can see this on page 756. If a muscle is not regularly stimulated to action, or if it is stretched beyond its normal limits for an extended period of time, it will lose its ability to contract and relax. For example, in foot drop, the calf muscles are shortened while the opposing flexor muscles are stretched. The result is loss of muscle tone and inability to produce motion. Performing range of motion exercises can prevent this. Muscles do become shorter and less elastic if not regularly contracted. A contracture could form after how many days of immobilization? We can also see this on page 756. An adaptive shortening or contracture will begin to form within 3 to 7 days after immobilization of a body part, and the process is typically complete within 6 to 8 weeks. What is the result if muscles are not regularly stimulated? We can also see this on page 756 in the bolded text. Within the matter of a few days, the structures of immobilized muscles and joints will begin to undergo changes. Muscles become shorter and less elastic if not regularly contracted. Which muscles should be stretched to prevent foot drop? So kind of read that one already, but that's also on page 756. In foot drop, the calf muscles are shortened while the opposing flexor muscles are stretched. The result is loss of muscle tone and inability to produce motion. How often should range of motion exercises be completed? We can see this on page 753 in the bolded text. Range of motion exercises should be done 3 to 4 times per day. Isometric exercises should be used with caution for which patients? We can also see this on page 753 in the red safety alert box. Isometric exercise can be contraindicated in patients with hypertension, increased intracranial pressure, or congestive heart failure, because isometric exercise will cause a significant increase in blood pressure and heart rate. What intervention should the nurse perform when the patient returns from an arthrogram? We can see this on page 748 in table 31.3, diagnostic tests and procedures for musculoskeletal disorders. Look at arthrography or arthrogram, as well as the nursing implications. The nurse should observe for swelling and apply ice as ordered. The nurse should first apply ice packs to the knee when the patient returns from the procedure, as long as they are ordered. The nurse should first apply ice packs to the knee when the patient returns from an arthrogram. What is the most stable crutch gait? We can see this on page 754 in the blue patient teaching box for crutch gaits. The 4-point gait, advantage, most stable crutch gait. How will you know the patient's cane is the correct length? We can see this on page 755. The cane is the right length if the hand grip is at hip level and the elbow is bent at a 30-degree angle when weight is placed on the cane. Define ligament. I'm going to go back to the beginning of the chapter for that. On page 743, ligaments join bones of a joint together. What cell builds bones? We can also see this on page 743. There are 3 types of bone cells. Osteoblasts are responsible for bone growth by making new bone cells and secreting collagen. What is a CPM machine? Who is it indicated for? And what is its purpose? So we can see this on page 753. Sometimes after a total knee replacement, the surgeon will order the attachment of an apparatus to the affected limb that provides continuous passive motion, or CPM, of the joint within set limits. This apparatus is driven by a motor and requires no effort on the part of the nurse or the part of the patient to move the limb. It'll be used intermittently throughout the day. When this type of apparatus is used, the nursing care plan should include specific instructions regarding its proper application and setting, as well as regular assessment of adequacy of pain relief. Pain is helped by the continuous circulation of ice water through a pad on the knee or affected joint. The cold can help reduce swelling, inflammation, and pain. So that's what a CPM machine is. It will be indicated for patients who are recovering from a total knee replacement, and the purpose is to help relieve pain as well as to mobilize that joint. What education will a patient need prior to their EMG to be properly prepared? So we're going to go back to table 31.3, and we can see this on page 749. Look at electromyography, or EMG, and also look at the nursing implications. Caffeine-containing drinks and smoking should be restricted 3 hours before the test. For what reasons are older adults more at risk of falls? We can see this on page 750 in the Older Adult Care Points red box. Approximately 30 to 40% of inpatient safety incidents are related to falls, and older adults are particularly vulnerable due to changes in aging, such as decreased strength, unsteady balance, loss of endurance, slow reflexes, gait disturbances, and increased postural sway, as well as chronic diseases such as arthritis. You should conduct a fall assessment. Pay attention to the increased postural sway that happens as older adults age. What action is necessary to prevent joint deformity? Would it matter if the person already suffered a joint deformity? We can also see this on page 750 in the bolded text. It is also necessary to change joint positions to prevent joint deformity. Observe during routine range of motion exercises. If any tightness or resistance to joint motion is noticed, position the joints extended so that the muscles are stretched to the normal limit to prevent the development of contractures. So no, it doesn't matter if they already suffered a joint deformity, we still need to change joint positions frequently to prevent further deformity. How should a patient be instructed to walk upstairs with crutches? So we can see this on page 755 in the blue patient teaching box, special maneuvers on crutches. Look at walking up the stairs. The patient should be instructed to put weight on the crutch handles and then lift the good leg onto the first step of the stairs. Remember that patients with flaccid paralysis should have their joint position changed frequently. Chapter 32, Care of Patients with Musculoskeletal and Connective Tissue Disorders, also in the MedSurg textbook. What is the big difference between a grade 2 and a grade 3 sprain? We can see this on page 760. A grade 2 sprain is considered moderate. It has some loss of function. A grade 3 sprain is considered severe. It has total loss of function and instability of the joint. That is the main difference. How do we treat sprains? We can also see this on page 760. RICE is the acronym used for treatment of sprains. This means rest, ice, compression, and elevation. Apply ice immediately after injury and for the next 24 to 72 hours. Apply the ice bag for 10 to 20 minutes every 1 to 2 hours throughout the day. Why do we not leave patients in air casts too long after a sprain? So we can see this on page 761. Air casts, braces, or supports are used only until the joint has been strengthened. If a joint is immobilized for too long and muscles are not exercised, muscle atrophy, which can begin in a matter of days, can lead to permanent disability. How should the patient be instructed to use ice for their sprain? So I already read that one. It starts on page 760 and continues onto the top of page 761. Also note that long-term immobilization can lead to permanent disability. Define bursitis. After which situation is this common? We can see this on page 762. Bursitis is an inflammation of the bursae. This is the sac-like structures that line freely movable joints. This occurs from injury or overuse and will often appear when a person has engaged in an unaccustomed activity, such as shoulder bursitis after digging up a garden plot in the spring. Bursitis can occur in any heavily used joint, but it most commonly affects the elbow, shoulder, hip, or knee. What types of careers place patients at risk of carpal tunnel syndrome? What's an intervention to help with this? So we can also see this on page 762. This type of movement that can lead to carpal tunnel syndrome typically occurs in certain types of factory work and in computer keyboarding. Sometimes there is just no known cause. Treatment is by rest, splinting, changing the angle of the wrist during repetitive movements, or steroid injection can help solve the problem. Carpal tunnel syndrome is a nerve problem that occurs when the median nerve is compressed as it passes through the carpal tunnel in the wrist. So that answered the next question. What nerve is compressed in CTS? That would be the median nerve. And also on 762. What assessment should the nurse perform after the patient returns from a surgical decompression of the median nerve? We can see this on page 763. Postoperatively, blood flow must be assessed hourly by checking color, warmth of the fingertips, and capillary refill. After anesthesia has worn off, sensation of the fingers should be assessed. You are an LPN student walking in the park. You observe an older man fall down park steps and obtain an open fracture of their right arm. You just happen to be carrying medical supplies. How would you proceed? We can see this on page 764. An inexperienced person should never attempt to straighten or set a bone. The injured part should instead be immobilized in the position in which it is found in at the time of injury. Splint it as it lies. So you would still help that individual by splinting it as much as you could, but you would not manipulate or move the bones in any way. You want to keep it as still, as immobile as you possibly can, and just splint it so that nothing else falls out of further alignment until you can get to a healthcare professional who is comfortable realigning that. What is an advantage of external fixation devices? We can see this on page 765. External fixation has the advantage of allowing more freedom of movement than traction, and it usually is more comfortable. So it allows for more freedom of movement, and it is typically more comfortable. Define signs and symptoms of osteomyelitis. We can see this on page 766. Osteomyelitis has a sudden onset with severe pain and marked tenderness at the site, high fever with chills, swelling of adjacent soft parts, headache, and malaise. What is the recommended non-pharmacological treatment for RA? We can see this on page 772. Treatment is aimed at relieving pain, minimizing joint destruction, promoting joint function, and preserving the ability to perform self-care. Rest and exercise, medication, immobilization with splints, and the use of other supportive devices during periods of severe inflammation, as well as hot and cold application, are standard treatments. RA patients should perform exercises every day, 3 to 10 times per day for every joint. A patient calls the doctor's office stating that she missed the past 2 days of her Fosamax medication, and she wants to know how she should proceed. So we can see this on page 782 in box 32.2, drugs commonly used to treat osteoporosis. Notice Fosamax is a biphosphonate, and check out the general nursing implications for biphosphonates. If a dose is missed, you should skip the dose. Do not take it later in the day. For the weekly dose medication, take it the next morning after your scheduled dose. Skip the dose if it has been 2 days since it was supposed to be taken, and then resume your original schedule. What is a safety concern nurses must be aware of when caring for patients with a hip abductor wedge? So we can see this on page 776 within the red safety alert box. Circulation should be checked after each application of the wedge to be certain that the straps are not too tight. Skin should be assessed every shift on the surface of the legs, with particular attention to areas over bony prominences. How should soft tissue injuries, such as sprains and strains, be treated? We can see this on page 761. Ice and compression should be applied immediately, and the body part should be elevated and rested. Heat can be applied after 48 hours. Anti-inflammatory medications are used for discomfort. When spasm is present, a muscle relaxant can be prescribed as well. What are some advantages of fiberglass casts? We can see this on page 765. Fiberglass and polyester cotton knit casts are lightweight, dry quickly, and can bear weight within 30 minutes of application. Chapter 13, drugs for inflammation, arthritis, and gout in the Introduction to Clinical Pharmacology textbook. What is the purpose of anti-inflammatory drugs? We can see this on page 238. An anti-inflammatory drug has a primary purpose to reduce pain and to prevent or limit the tissue and blood vessel responses to injury or invasion. A patient taking aspirin is at an increased risk of patient taking aspirin has an increased risk of bleeding. We can see this on page 241. Older adults taking NSAIDs have a higher incidence of excessive bleeding and perforated ulcer compared with younger adults. Older adult patients who have some degree of renal impairment are at a higher risk for damage to the liver and kidneys caused by NSAIDs. These drugs should be avoided in older adults. If they are prescribed, they should be administered with a proton pump inhibitor like Prilosec to reduce the risk of GI effects. When should the patient stop taking aspirin prior to a dental procedure? So we can see this on page 242. Stop taking aspirin 7 days prior to a dental procedure. What strategies can minimize GI upset when taking an NSAID? We can also see this on page 242. Give the NSAID with a full glass of water to reduce the risk of GI disturbances. If the patient has a stomach upset, try giving the drug with food or milk to reduce the symptoms. These drugs can cause stomach upset, and NSAID should be taken with a full glass of water and/or food. What are some adverse NSAID effects that need to be reported to the prescribing provider immediately? We can also see this on page 242. Contact your healthcare provider right away if ringing in the ears, abnormal bleeding or bruising, or bloody, black, tarry stools are noted. Why is aspirin contraindicated in pediatric patients with acute illness? We can see this on page 241 in the green lifespan considerations box. Aspirin should not be given to infants or children with an acute illness due to its association with the development of Reye syndrome. This disorder can lead to mental deficits, coma, or death. Should alcohol and NSAIDs be taken together? Why? No, they should not be taken together. We can see this on page 241. Alcohol taken with any of the NSAIDs will increase the risk of GI bleeding. A diabetic patient taking a short-term course of prednisone notices their blood sugar is more elevated than it normally is. Why? What should he continue to do? We can see this on page 243. It is not unusual for patients, particularly diabetics, to have an elevated blood sugar level, and doses of insulin or an oral hypoglycemic agent might need to be adjusted while the patient is receiving steroid therapy. So these patients should continue to monitor their blood glucose regularly. What side effect can occur with long-term use over a month of corticosteroids? We can see this on page 244. So we can see this on page 244 in box 13.1, common side effects of systemic corticosteroids. Look at the side effects occurring within 1 month after therapy. Notice fat distribution, causing a moon face and buffalo hump between the shoulders. How does long-term corticosteroid use affect immunity? We can see this on page 245. Any use of corticosteroids also reduces the number of white blood cells. This can decrease inflammation, but also decreases the immune response. The longer the patient has been taking a corticosteroid and the higher the dose, the more immunity is reduced. A patient has been on corticosteroid therapy for 1.5 weeks, and they ask if it's okay to stop taking it tomorrow. What is your response? We can see this on page 244 going into page 245. Patients who have been taking any corticosteroid daily for 1 week or longer must slowly decrease the dose over time, known as tapering, rather than just stopping the drug suddenly. Tapering of the drug will allow the atrophied adrenal gland cells to gradually begin producing cortisol again and prevents acute adrenal insufficiency. Why should a topical corticosteroid not be placed inside or on top of an open wound? We can see this on page 243 within table 13.2, common corticosteroid drugs. Never apply a topical corticosteroid cream, ointment, or lotion to a skin area that has indications of infection because the infection will spread. How does steroid therapy affect the skin? Which patients are at an even greater risk of skin tears? So we can see this on page 246. Steroids tend to thin the skin, and their use increases the risk of skin tears. Steroids can also slow wound healing, and therefore must be carefully assessed in patients who are to have any type of surgery. How do DMARDs work? We can see this on page 247. A disease-modifying antirheumatic drug reduces the progression and tissue destruction of the inflammatory disease process, especially in rheumatoid arthritis, by inhibiting the tumor necrosis factor. How do DMARDs affect immunity? We can see this on page 248. All DMARDs reduce the patient's immune response to some degree, increasing the risk of infection. What are some nursing considerations related to administering DMARDs? We can see this on page 247 within table 13.3. Take a look at the nursing implications. You should rotate injection sites on the front of the thighs and the abdomen to ensure best absorption and prevent skin problems. Avoid giving this within 2 inches of the umbilicus because this area has many blood vessels and the absorption could be too rapid. Do not rub the site after giving the injection to prevent any bleeding and bruising at the site. What laboratory value would you expect to be elevated in a patient experiencing an acute episode of gout? So we can see this on page 249. Gout is a metabolic disorder that causes a person to produce or accumulate too much uric acid crystals from the proteins that they eat or to not eliminate crystals in the urine. So you would expect their uric acid level to be elevated. Chapter 17, Drugs for Osteoporosis and Hormonal Problems in the Introduction to Clinical Pharmacology textbook. A patient newly diagnosed with hypothyroidism asks how long they will need to take medication for this condition. We can see this on page 313. These problems can be prevented by HRT with drugs known as thyroid hormone agonists. Therapy is usually needed for the rest of the person's life. A young female patient is taking levothyroxine sodium for hypothyroidism and asks if it's okay to breastfeed her newborn. We can see this on page 314 in table 17.2, examples of common drugs for thyroid problems. Notice levothyroxine sodium is a thyroid hormone agonist, and check out the nursing implications. Pregnant women may need a higher dose, and women who are taking thyroid hormone agonists are advised not to breastfeed because the drug can be found in breast milk. What is an important drug interaction to be aware of when administering thyroid hormone agonists? So we can see this on page 314. When thyroid hormone agonists are taken with drugs that reduce blood clotting, such as anticoagulants, especially warfarin, their actions are increased. This response can cause excessive bleeding and bruising. Why should the nurse assess vital signs prior to the administration of a thyroid hormone agonist? So we can see this on page 314 within the table 17.2. Check the patient's heart rate and blood pressure before giving this drug because increased heart rate and blood pressure can result. How do drugs to treat hypothyroidism work? So we can see this on page 314. We can see this on page 313. A thyroid hormone agonist is a drug that mimics the effect of thyroid hormones T3 and T4, helping to regulate metabolism. These drugs work like natural thyroid hormones by moving through the blood and entering all cells. How do anti-thyroid drugs work to treat hyperthyroidism? We can see this on page 314 within table 17.2. Anti-thyroid drugs reduce thyroid hormone levels by entering the thyroid gland and combining with the enzyme responsible for connecting iodine with tyrosine. Without this iodide-tyrosine connection, the thyroid hormone production is suppressed. Why should the nurse assess for jaundice when administering Propofol? So we can see this on page 314 within table 17.2 and check out the anti-thyroid drugs as well as their nursing implications. You should check the patient daily for yellowing of the skin or sclera that could indicate jaundice. And the reason for this is because these drugs can cause liver toxicity. So that's why you would assess for jaundice. How long will it take for the anti-thyroid drugs to be effective in a patient? We can see this on page 316. The drugs do not affect stored hormones, so it may take several weeks before the effects of all stored thyroid hormones are gone. Also see the top tip for safety. Teach patients that thyroid suppressing drugs must be taken for 3 to 4 weeks to start being effective because they have no effect on the thyroid hormones already stored in the thyroid gland. What is an adverse effect of anti-thyroid medications, and how can the nurse be alert to this possible complication? We can see this on page 316 going into page 317. Bone marrow suppression can occur, causing anemia and increasing the risk of infection. So check the patient's blood counts for signs of bone marrow suppression, like a low white blood cell count, anemia, or thrombocytopenia. Which condition would you expect to assess a goiter? That will be hyperthyroidism, and we can see that on page 316. Some types of hyperthyroidism cause the patient to have a goiter. This is a swelling in the neck caused by an enlarged thyroid gland. How does fludrocortisone work in the body? We can see this on page 318. Fludrocortisone is a synthetic drug that acts like natural aldosterone. What is an adverse effect of fludrocortisone, and how can the patient work to prevent this? We can also see this on page 318. Heart failure is a serious adverse effect of fludrocortisone. If heart failure develops, the drug dose should be reduced or stopped. The patient can work to prevent this adverse effect by assessing their weight daily. What are common side effects of drugs that suppress adrenal hormone production? We can see this on page 319. Common side effects for drugs that suppress adrenal hormone production are likely to cause nausea, vomiting, rashes, and dizziness. Which drug to treat adrenal gland hyperfunction can only be taken by patients with type 2 diabetes, hyperglycemia, and hypercortisolism? We can see this on page 319 within table 17.3, examples of common drugs to treat adrenal gland hyperfunction. Take a look at mifepristone, or Korlym. It is a corticosteroid receptor blocker. And look at the nursing implications. This drug is used only for people with type 2 diabetes who have hyperglycemia as well as hypercortisolism. What causes the symptoms of menopause? We can see this on page 320 within the orange memory jogger box. Symptoms of menopause are caused by low levels of estrogen and high levels of FSH. What is an adverse effect of drugs for menopause relief? We can see this on page 322. Estrogen and progesterone drugs increase the risk of blood clotting and inappropriate development of thrombi and emboli. What are common side effects of perimenopausal HRT? We can also see this on page 322. The most common side effects of perimenopausal HRT are breast tenderness, breakthrough bleeding, fluid retention, weight gain, and acne.